Our first question is for Alyssa at Columbia. How do you identify and recruit candidates for your advisory boards, and are they compensated in any way for their participation?
We usually identify our community board advisors through existing community board members, just through our networks in the community, and through our main community partner, WEACT. They all have networks and have ideas of individuals who would really contribute to the work that we do. We do provide our community board members with a small stipend to compensate them for their time and effort, and expect them also between meetings to help participate in the work we do.
Thank you very much. Next question also for Alyssa. What types of questions did they ask in your environmental health survey? You mentioned that there were 25 questions.
So for the focus groups, the questions were kind of dual-purposed. One was just knowledge about environmental health, awareness about different exposures inside the home, what people viewed as being harmful, and then we also asked specifically about the material that we were developing. So we had mock-ups of the material and the content, and we asked questions about, what they thought about it, what did they find confusing, what did they like, and that helped us to guide going forward with the material of what was useful information and what we should take out.
We had a couple questions about whether the PowerPoint presentations will be available. The recording of the webinar will be available on our website, but the PowerPoint presentations are not going to be posted at this time, but if they were posted, it would be on the same site. Our next question is for all of the speakers, anyone who would like to address it. How are you using current research from psychology or in other disciplines, for example, conservation psychology, to support best practices of personal behavioral change? The questioner is saying it seems that the environmental context can impact personal health behavior. So how are you working to change the environmental context and the messaging as well? Would any of the speakers like to address that? Basically, it's about personal behavioral change and how you might be changing your environmental messaging to impact personal health behavior.
This is Patrice. Can you hear me?
Yes.
Well, if I'm understanding it right, the question is really about the relationship between kind of the environment and individual behavior. And I'm not personally knowledgeable about the literature that was asked about, but conceptually, we are particularly sensitive because of not wanting to put a burden on pregnant women's shoulders, like here's another thing as an individual you can do, and kind of, it evokes images of, bad mothers kind of if you're not just buying the most expensive thing that's EPA-free and all of that type of thing. And obviously, as everyone on this call knows, there's huge challenges and disparities in terms of people's capacity to make changes on an individual level. Not to say that individuals can't take action, but it's in a very, very important relationship with the environment of the environment itself that surrounds individuals and communities, like what's available to them in the first place, and then the policy upstream that really drives what communities look like. So we actually pay a lot of attention to this issue because, as I said, our messaging is very much not like, we do want to very much empower pregnant women to make good choices, but really we kind of never talk about it as just what an individual can do. And I noticed in the one of the talks, I think Alyssa's talk, the idea was about creating change being one of their themes. And I think that we kind of echo that same idea, is that really it is working for upstream policy change that is going to create the environments that make it possible for people to make good choices. And there's a lot of literature, and I don't know if it's from that particular literature that was being discussed, but conceptually there is a lot of literature around obesity that we've looked to, which really, in terms of what's available for people, that there is this relationship between, what's available for someone to make good choices, and so you have to kind of change the the built environment as much in order to influence personal choice. I don't know if that's what they were asking, but we do think a lot about that relationship.
And the questioner is also asking, are you using current research from psychology or other disciplines to support personal behavioral change? Any of the speakers would like to mention anything about that?
This is Amy Kyle. Can I go ahead?
Oh, yes, please.
Well, this is kind of indirect, and I'm not going to take the time to kind of explain all the intervening logic, but one of the things we're doing more broadly, not only with regard to personal behavior, but in general, is really to work on our imagery. And I mentioned that we were looking at using more visuals. We're trying to work more with people who are artists or have training in that way. And the reason behind that is to move some of the ways we think about this into a different kind of space, and that's based partly on research from environmental psychology. So as I say, it's kind of a roundabout logic from where the questioner started, but that's one thing that we're doing, so I wanted to mention that.
And any of the other speakers would like to add anything?
Hi, this is Daniel, and although I'm not up on the psychology literature that was being referenced, I think that as we do our youth work, really the first step before we get into any of the questions as to whether people change their behaviors, first they have to understand what the problem is and to learn about these different environmental exposures. So that's really more of the focus of our work at this point. And then as these children get older, they can then have the choice, or maybe not the choice depending on the other factors in their lives, but they can better understand that this is an issue and to hopefully be better informed to respond accordingly.
This is Phil Brown. I wanted to also speak to this issue. Very similar to what Patrice said, that you don't want to burden mothers and prospective mothers with their endless amounts of things they could think about. Healthcare workers are really busy, and they're often in a very crisis mode. And you have to think also there too, how do we ask them to do something else? And we do it partly as with the Blue Wrap, by making it fun, by having a dance, by having a cultural event, by combining the arts with the environment. But also one of the things that Monica Anderson did at the Miriam Hospital was to develop an award system, and really praise people and, put notices up on the bulletin boards about people's efforts and give them a chance to shine for efforts that they had done. In the healthcare sector, people take a lot of pride in taking care of people and saving lives and preventing illness. And if they can figure out other ways to do it, they really tap into that. So I think we have to just really think about people's general attitudes and ideas about, doing much better work wherever they are.
So we have a couple of questions for Patrice about the ACOG survey. One question is, on slide 9 that you showed, there was a map of the U.S. with different shades of red. What did the different shades of red indicate? And the other question about the ACOG survey was, why were Vermont, New Hampshire, and Massachusetts, and Maine excluded from the survey?
This is Patrice, and I wanted to see if you could unmute my colleague, Jessica Trowbridge, who actually might be able to give an even more thorough answer, who's on the call. Is that possible?
She should be able to do that herself by just clicking the X. And
okay, I didn't know if the
yeah, she should
who
be able
was
to do that
in charge.
So, hello, can you hear me?
Yes.
And I just want to say Jessica really has spearheaded the analysis of the data and created that beautiful map. So I just want to acknowledge not only that she's answering the question, but she's because of her work.
Thank you. So we didn't exclude any states in particular. It was just that we got few responses for states that had fewer populations of obstetricians and gynecologists. So we did have representatives from every state in the country, but some were just lower, and I don't recall the exact number. And could you repeat the first question?
The first question were, what were the red areas indicated on the map?
Oh. The red areas were just kind of a way to show concentration of obstetricians and gynecologists. And this doesn't, it's not an average of, it's just a total number. So California has a high population, so therefore has a high population of obstetricians and gynecologists. Also not on the map, obviously, are Hawaii and Alaska, who also had numbers of OBGYNs in their populations, but just in terms of the graphic, to make it clear, it tried not to crowd it out too much. So it's more of looking at the dots. It was just kind of to demonstrate that the obstetricians come from across the country, that we're getting, you know, a pretty good example, I think, of OBs across the country.
Okay, very good. Well, thank you very much. And if you can remute your line just to avoid noise on the line, we'd appreciate that. Another question is, how do we get Native organizations involved in these community programs? That's directed to all of the speakers. I'm not sure if the questioner was referring to Native American organizations or local organizations, but maybe you can take it either way if you'd like to talk about how to get more local organizations involved in the programs that you're working with.
I can start with this one. Through our community outreach program at the Chimanco study, we do a lot of work with our community partners to build capacity so that other health workers and other leaders in the community have information to reduce children's environmental health exposures. And as for Native organizations, this is slightly related, but we do work with the indigenous communities from Guatemala who are in the southern areas of our Salinas Valley area. So although not native, I guess, to the United States, but still indigenous populations.
Any of the other speakers that'd like to add anything? So the next question is for Amy Kyle. The question is, how does working with the Pediatric Environmental Health Specialty Units, or the PESUs, in particular, help your work? Could you give some examples or specifics of working with the PESU organizations?
Well, actually, it's helped our work a lot more than we even might have thought it would, in that the director of the PESU that we work with here has come to participate in our internal discussions and deliberations about our research designs and approaches, and it's just added an additional dimension to our understanding of some of our issues from the pediatric perspective, you know, both the practice and also the knowledge base there. And I'm not sure we quite had anticipated learning as much from that as we have. So it in terms of our own research component, it's been very beneficial. What we had hoped for and anticipated was that the Pediatric Environmental Health Specialty Units serve as a point of outreach to people who are thinking about children's environmental health in a healthcare setting. Many of them are pediatricians, but they're not only pediatricians, and there's a whole information flow from that network that takes different kinds of forms, some of which is publications and some of which is fact sheets and so on. And so we wanted to connect our information stream and our knowledge base into that network so that information relevant to the exposures that we're working on, and, you know, our findings about homes and the significance of certain chemicals, and, you know, this remaining significance of smoking, which actually I don't think we've mentioned on this call, et cetera, would be fed into that. And so that was what we had hoped had happened. And, you know, it takes a little while to get that all going, and for all the institutions to get to know each other and figure out what's significant, and then prepare the relevant messages and so on. But we think it's a very important channel, so we're working through all that.
And maybe for all of our participants who may not be familiar with the PESUs, there's one in each of the EPA 10 regions of the U.S., and they're clinical units with physicians and healthcare professionals that are affiliated with other environmental health, with environmental health practitioners in the area, and so they can actually take cases of people who have environmental health issues that can bring to the PACU for investigation, and they also serve as leaders in their communities on environmental health issues. So the next question is for, yes, go ahead.
This is Patrice. I just wanted to see if I could just add on, because we have here the PACUs are a very, very key partner, as I was even indicating in terms of the meeting that took place in Chicago last September that was funded by EPA. And one of the reasons, in addition to the way that it's worked with Amy's center, is that for us, very specifically, the PACUs are, and you alluded to it, that's where actually the knowledge base is currently for actually if you have a case. I mean, so we're trying to get people to answer, to get obstetricians to have this relationship to pediatric health, but then once they open Pandora's box and get training and capacity to actually ask people questions about their environment because it's such an important driver of their patient's health, then what happens when someone says, well, as a matter of fact, actually, like, I'm drowning in xylene at my job, because obstetricians at this point really do not have that capacity. So one of the key reasons that we've also worked very hard to make those relationships and build those bridges is because really we need to strengthen the PACU network so that, and one of the goals of our collaboration with the PACU network is really to ultimately have obstetrics, to have that expertise on the PACUs so that people are working seamlessly. But right now, it's really essential for physicians to be able to ask their patients a question. They need a referral service. They need to know who they can call to answer questions for which they don't have the expertise. And the PACUs are just incredibly, they're really the unique and very valuable resource that we have in the country right now for that.
Very good. Thank you very much. And we should also mention we're going to be holding a public meeting with the Children's Centers and the PACUs this October, at the end of October. So please watch for more information about that. And it will be held in the Washington, D.C. area, and that is open to the public. Our next question is for Phil. The questioner is asking, could you speak a bit about how you identified and received funding for your excellent program?
Well, we used money that was in our budget for the Community Outreach and Translation Corps. It turns out, of course, with federal grants you can't buy food for conferences, and what we were able to do was to get vendors to put money up to pay for the food and other unallowable expenses. We decided, after a lot of discussion, not even to charge a nominal fee because we wanted to get as many people as possible to come. And so we wanted people who were involved in environmental groups or who were nursing students at one of the local colleges. So basically we ran it pretty much on a very small amount of money. Apart from what we got for the food, it didn't cost us money to use the space because we were using Brown University space and we didn't have any facility costs for that. And otherwise everything in printing and publicity and things of that sort, we had our own budget in the COTC.
Thank you. Our next question is for Daniel Madrigal from UC Berkeley Eskenazi Children's Center. How do you support the work with the youth groups in the area? Does your group host the student youth groups? And are the youth involved through certain partnerships that you build in the community?